Vital signs are kind of like the body's own secret language. They're telling us a story in real time about what's happening with a patient's health. They're the clues that can point to everything being just fine or signal a major crisis. So let's get into it and learn how to decode that language together.
Welcome to Nursing Journey. So let me ask you this. What are the 6 most fundamental, absolutely essential tools you're going to use to figure out what's really going on inside a patient's body? We're about to break them all down, one by one.
And here's how we're going to do it. First, we'll cover the basics, what vital signs even are. Then we'll walk through each of the 6 pair by pair. And we'll wrap it all up by talking about what really matters most, how you use these numbers to make critical clinical judgments.
Okay, first things first. What exactly are vital signs? I want you to think of them as the absolute foundation, the bedrock of your entire patient assessment. Seriously, everything else you do builds on this.
At their core, these are your most basic fundamental tools. They give you a baseline, right? That all-important starting point. And from there, you can track a patient's condition and spot any changes, whether it's a tiny, subtle shift or a huge, dramatic downturn.
And here they are, the big 6. Temperature, pulse, respirations, blood pressure, pulse oximetry, and pain. These normal ranges for an adult, you absolutely have to commit these to memory. They're going to be your reference point for pretty much everything.
Now, this is a really important point about professional responsibility. You might be able to delegate the task of taking a temperature to someone else, but you can never, ever delegate the responsibility of figuring out what that number means. That clinical judgment, that's always on you.
All right, let's dive into our first pair, temperature and pulse. You can think of these as the body's thermostat and its internal pacemaker. They give us an instant snapshot of the body's metabolic state and circulation.
Okay, when it comes to temperature, how you take it is so critical. A rectal temp, that's going to give you the most accurate core reading. It's the gold standard. On the flip side, an axillary temperature, in the armpit, is usually about ½ degree Celsius lower than an oral reading, and that's a huge difference you have to account for.
So when you feel for a pulse, you're doing way more than just counting beats per minute. You're grading its strength. A good normal pulse is what we call a 2+. If it feels kind of weak and thready, that's a 1+. If it's super strong, like pounding against your fingers, that could be a 4+. And a 0? Well, that's an emergency. It means the pulse is absent.
The radial artery in the wrist is your usual go-to spot for sure. But the apical pulse, listening right over the heart, is so important, especially if the rhythm is irregular. In that case, you have to listen and count for 1 full minute. And here's the kicker. If that apical rate is higher than the radial rate, that's called a pulse deficit. It's a huge red flag that the heart's contractions aren't strong enough to get blood out to the body, and you've got to investigate that right away.
Next up, let's look at the actual mechanics of getting oxygen in and pumping blood out. We're talking about respirations and blood pressure. For respirations, the standard procedure is to count for 30 seconds and then just double it. But, just like with an irregular pulse, if that breathing pattern seems off at all, you need to watch them for a full 60 seconds. And here's a little pro tip for you. Keep your fingers on their wrist like you're still taking their pulse. That way, they don't get self-conscious and change their breathing pattern on you. It works every time.
Now, this table shows the modern blood pressure guidelines, and I want you to notice something really subtle but so important. For stage 1 hypertension, look there. It's a systolic of 130 to 139 times or a diastolic of 80 to 89. That little word or is key. It means only one of those numbers has to be in that range to classify as stage 1.
All right, let's do a quick practical question. Let's say you grab a blood pressure cuff, and it's obviously way too small for your patient's arm. What kind of error is that going to cause in your reading? Take a second and think about it.
The answer is, it'll give you a falsely high reading. But why? Well, think about it. The cuff has to work extra hard. It has to squeeze with a lot more force to actually compress the artery. And that extra effort artificially inflates the number you see on the screen. It's one of the most common mistakes out there, so always get the right size cuff. Let's move on to our final pair here. We've got pulse oximetry, which is a really objective measure of oxygen in the blood, and pain, which is a profoundly and completely subjective experience.
When we're talking about pulse oximetry, or SpO2, there is one critical number, a threshold that you have to be watching for, a number that should make you stop whatever you're doing, and it's this one right here. So here's the bottom line. An oxygen saturation level below 90% is a critical value. This is not a wait-and-see situation. This isn't a let's check again in a bit kind of thing. This requires you to act immediately and notify the primary healthcare provider. It's a sign of serious hypoxia.
And last but not least, we have pain. People often call it the fifth vital sign, and it is 100% subjective. If your patient tells you their pain is a 9 out of 10, then for the purposes of your assessment, their pain is a 9 out of 10, period. Your role here is to believe them, assess the situation, and be their advocate.
Okay, so let's put this all together. This last section is all about taking this data, all these numbers, and turning them into real, decisive clinical action. This is truly where a great nurse shines.
Think of this as your action cheat sheet. I want you to notice how every single critical value is paired with a direct nursing intervention. A patient on opioids has a respiratory rate under 12, you hold that medication and you call the provider. A white blood cell count under 5,000, you start neutropenic precautions. It's all about pattern recognition. You see the number and you take the action.
And that really brings us to our final and honestly our most important thought. These numbers, by themselves, they're just data. The true skill of a nurse is in the interpretation. So I'll leave you with this question. How are you going to take these numbers and turn them into the actions that protect and heal your patients?
If you found this explanation helpful, don't forget to like, share, and subscribe or follow for more.